11 fatal mistakes when measuring blood pressure that you need to avoid now. Have you ever stopped to think about whether you are measuring your blood pressure correctly? Could small errors in the process be masking the results and even putting your health at risk? Plus, how do you ensure that the readings accurately reflect what's really happening to your body? Blood pressure is one of the most important indicators of your cardiovascular health. An incorrect number can lead to hasty diagnoses or even unnecessary medication use. Therefore, knowing how to avoid the most common mistakes is essential to ensure a healthier life. In this text, you will discover the main mistakes that can influence your measurements, and you will learn how to correct them in a practical and efficient way. Ready to protect your health with reliable, practical information? Let's get started. The secret that your clothes are hiding when measuring your pressure. One of the most common and least discussed mistakes when measuring blood pressure is wearing the cuff over clothing. Many people, in an attempt to save time or due to lack of guidance, place the device over their shirt or blouse without realizing the impact of this on the results. This practice can artificially raise blood pressure readings by up to 20 points, a significant variation that can lead to unnecessary concern or even misdiagnosis. The reason for this change is simple. The clothing acts as a barrier, interfering with the uniform compression of the arm by the cuff. This prevents the device from properly measuring the pressure in the arteries, generating inaccurate numbers. Therefore, it is essential that the cuff is in direct contact with the skin, ensuring a more accurate and reliable reading. Even in doctors' offices, this error is not uncommon. Due to lack of time or carelessness, professionals may perform the measurement inappropriately on the patient's clothing. If you notice this situation, do not hesitate to ask for the procedure to be carried out correctly. Remember, your health depends on accurate data. To avoid this mistake at home, always remove your shirt or adjust the sleeve so that your arm is fully exposed. Make sure the cuff is positioned on the upper arm, with the marker aligned with the brachial artery. With this simple precaution, you guarantee a reliable measurement and avoid unnecessary scares. Now that you know how this little slip-up can change your numbers, you're prepared to fix this mistake. But what about the position of the arm during the measurement? Could this also influence the result? Find out in the next topic. Wrong arm position. The silent error that changes your results. The position of the arm during blood pressure measurement is an often overlooked detail, but it can have a significant impact on the results. If the arm is below the level of the heart, the reading may be artificially high. On the other hand, if it is much higher, the numbers may be lower than the real one. This silent error can go unnoticed and lead to inaccurate measurements that affect important healthcare decisions. The reason for this is the influence of gravity. When the arm is in an inappropriate position, blood flow undergoes changes that affect the pressure recorded by the device. Therefore, it is essential that the arm is supported and aligned at heart level throughout the measurement process. Unfortunately, even in doctors' offices, it is common to encounter situations in which the patient measures their blood pressure with their arm hanging or without adequate support. To avoid this problem, always ask for support, such as a table or a pillow, to keep your arm at the correct height. If you are at home, be sure to use a comfortable location where your arm can remain still during the measurement. Furthermore, it is important to keep the elbow slightly bent and supported to avoid tension that could also interfere with the numbers. A relaxed and stable posture is essential to ensure an accurate reading. Now that you understand the importance of aligning your arm with your heart, it's worth asking yourself, how snug is the cuff on your arm? Is it too tight or too loose? This may be another factor that compromises accuracy. The answer is in the next topic. The tightness that may be raising your blood pressure. A surprisingly common mistake when measuring blood pressure is adjusting the cuff incorrectly. Both over-tightening and too loose an adjustment can generate inaccurate readings, compromising results. This apparently simple technical detail is one of the biggest reasons for numbers that do not reflect reality. When the cuff is too tight, it can compress blood vessels more than necessary. This excessive compression results in higher than actual readings and can lead to misdiagnoses of hypertension. On the other hand, If it is too loose, the device may not record blood pressure accurately, resulting in artificial numbers. The secret to correct adjustment lies in a simple test. After positioning the cuff on your arm, you should be able to slide 2 fingers between the device and your skin. If you can insert 3 or more fingers, it is too loose. If you cannot insert even 2 fingers, the cuff is too tight. This balance is essential to ensure reliable measurement. Another important point is the position of the artery marker on the cuff. Make sure it is aligned with the brachial artery, which is on the inside of the arm. This orientation is essential for the device to capture pressure correctly. If you are in an office and notice that the healthcare professional has adjusted the cuff improperly, don't hesitate to question it or ask to check it. Your health is at stake, and ensuring accurate measurements is your right. Now that you know how cuff adjustment can impact your measurements, have you considered the influence of the body's resting state during the procedure? Is measuring blood pressure in times of stress or agitation a good idea? The answer is in the next topic. Are you really relaxed before taking your pressure? One of the most critical factors for an accurate blood pressure reading is the body's resting state. Many people make the mistake of measuring their blood pressure right after physical activity, moments of stress or situations in which the body has not yet returned to a calm state. This slip-up can distort the results and lead to incorrect interpretations. Blood pressure is, by definition, the force that blood exerts on the walls of the arteries in a resting state. Therefore, measuring it while the body is agitated, whether from walking, physical exertion, or an anxiety situation, will reflect a temporarily elevated number, not a real condition. In medical offices, it is common for patients to be rushed into the room immediately after climbing stairs or walking long distances. Without time to recover, the measured pressure ends up being artificially high. To avoid this problem, ask the professional to wait 5 to 10 minutes before taking the measurement, allowing the body to reach a relaxed state. At home, take a quiet moment to measure your blood pressure. Avoid physical activities or stressful situations at least 15 minutes beforehand. Sit comfortably, keep your feet flat on the floor, and breathe deeply to help stabilize your heart rate. If your routine requires you to monitor your blood pressure regularly, it is good practice to write down the times and conditions under which measurements are taken. This way, you can identify patterns and avoid inaccurate readings caused by agitation or stress. Now that you know the importance of resting, have you ever stopped to think about how other simple factors, such as a full bladder, can change the results? The next topic explains why this seemingly insignificant detail cannot be ignored. How a full bladder can ruin your measurements. Something as simple as a full bladder can significantly interfere with your blood pressure reading. Although many people do not attach importance to this detail, it is one of the factors that most often generate artificially high numbers without the patient noticing. When the bladder is full, the body activates the sympathetic nervous system, responsible for the fight or flight response. This activation may temporarily increase heart rate and blood pressure, distorting measurement results. Studies indicate that this change can be up to 10 points, enough to influence a diagnosis. In the doctor's office, it is common for patients to wait long periods before their appointment, often without the opportunity to use the bathroom. When called, they end up measuring the pressure in a state of discomfort, which can result in inaccurate numbers. The solution is simple. Before taking any measurements, be sure to empty your bladder. This care not only contributes to more accurate results, but also avoids discomfort during the procedure. If you take measurements at home, make it a habit to check your need to go to the bathroom before using the device. This small adjustment to your routine can make all the difference in the reliability of the numbers. Now that you know how something as simple as a full bladder can change results, it's time to look at another common habit that can compromise your measurements: crossing your legs. Does this also affect your blood pressure? Find out in the next topic. Crossed legs. A harmless habit or a risk to your health? Crossing your legs while measuring blood pressure is a common habit, but it can significantly compromise the results. Although it may seem harmless, This posture alters blood circulation and can generate artificially high readings, causing unnecessary concern or misdiagnosis. When the legs are crossed, the blood vessels in the lower extremities suffer slight compression, making it difficult for blood to return to the heart. This change in blood flow can temporarily increase blood pressure, especially systolic pressure, which is the first number recorded in the measurement. In the doctor's office, patients often assume this posture without realizing it. If the professional is not attentive, the results may be compromised. To avoid this problem, remember to keep your feet flat on the floor and your legs uncrossed throughout the measurement. At home, adopt the same care. Sit in a comfortable chair, keep your back against the back, and place your feet parallel to the floor. This stance not only helps prevent changes in the numbers, but also contributes to a more stable and reliable reading. Additionally, it is important to be aware of other habits that, combined with crossed legs, can further increase the risk of inaccurate results. For example, caffeine consumption before measurement can also affect the numbers, as we will see in the next topic. So if you want to ensure accurate measurements, the first rule is simple. Keep your feet on the ground. But what happens when you drink coffee before taking your blood pressure? Discover the impact of this practice below. The impact of coffee on your blood pressure. You didn't know. Have you ever stopped to think about the effect that a simple cup of coffee can have on your blood pressure? Although many people consider coffee an ally to start the day, it can be a villain when it comes to measuring your blood pressure. Caffeine, present not only in coffee, but also in teas, energy drinks, and even chocolates, is a substance that directly affects the cardiovascular system. When consumed, caffeine stimulates the sympathetic nervous system, increasing the heart rate and causing a slight narrowing of blood vessels. These changes can raise blood pressure by up to 20 or 30 points, depending on the person's sensitivity. This increase can last for 2 to 3 hours, which means that even one cup of coffee in the morning can affect the results of a measurement taken the following period. In the doctor's office, this detail is often ignored, especially if the patient arrives at the appointment right after consuming caffeine. The result? Artificially high readings that can lead to misdiagnosis of hypertension and, in some cases, unnecessary medication use. To prevent this from happening, avoid consuming caffeinated foods or drinks at least 3 hours before taking your blood pressure. This will ensure that the numbers reflect the actual state of your body, without the temporary influence of the stimulant. If you need to measure your blood pressure regularly at home, it is also important to monitor your diet and caffeine consumption schedule. Writing down these details can help you identify patterns and adjust your routine to get more accurate readings. Now that you know how caffeine can change your measurements, it's time to address another factor that's often overlooked: using the wrong arm to measure blood pressure. Could this also influence the numbers? Wrong arm, wrong result. What you need to know. Choosing the correct arm to measure blood pressure is a detail that often goes unnoticed, but it can make all the difference in the results. Although the left arm is the recommended standard, many people, and even healthcare professionals, measure the right arm without considering the implications of this choice. The preference for the left arm is due to its proximity to the heart. This position provides a more accurate reading of central blood pressure, which is the most accurate measurement for assessing cardiovascular health. Using the right arm can generate variations in the numbers, especially in people who have natural differences in pressure between the two sides of the body. There are specific situations in which the right arm can be used, such as in patients who have had surgery, have problems with the blood vessels in the left arm, or suffer from conditions such as lymphedema. However, these cases are exceptions and should be evaluated by a healthcare professional. If you take the measurement at home, be sure to always use the same arm to maintain consistency in results. The ideal is to measure the pressure in the left arm, unless there is a medical recommendation to do otherwise. Also, take note of the conditions under which the measurement was taken to identify any patterns or discrepancies. At the doctor's office, don't hesitate to question if the professional chooses to use the right arm without justification. Remember that accuracy of results is essential for a reliable diagnosis. Now that you know the importance of using the correct arm, it's time to discuss another crucial aspect: the use of pulse monitors. Are these devices as reliable as traditional models? Find out in the next topic. Wrist monitors, friends or foes of accuracy? Wrist monitors are often chosen for their practicality and portability, but do they offer the same accuracy as traditional arm models? The answer is that, although useful in some situations, these devices have important limitations that can affect the reliability of measurements. Wrist monitors work in a similar way to arm models, but their location is more sensitive to movements and changes in body position. Even a small change in the height of the pulse in relation to the heart can influence the results. Additionally, the arteries in the wrist are thinner and shallower than those in the arm, making measurements more susceptible to error. This doesn't mean that pulse monitors are useless. In situations where the use of an arm monitor is unfeasible, such as in people with very large or painful arms, these devices can be a valid alternative. However, it is essential to use them correctly to minimize inaccuracies. When using a wrist monitor, keep your arm and wrist aligned at heart level and remain completely still during the measurement. Be sure to follow the manufacturer's instructions and repeat the measurements a few times to get a reliable average. If you regularly use a wrist monitor at home, it's a good idea to compare your readings with those from an arm model at doctor's appointments. This can help check the consistency of the results and identify any discrepancies. Now that you know the advantages and limitations of pulse monitors, it's time to address another common mistake that can compromise your measurements: talking during the procedure. Can talking really interfere with results? Find out in the next topic. Talking during measurement, a detail that changes everything. Did you know that something as simple as talking while measuring your blood pressure can interfere with the results? Although it may seem harmless, talking during the procedure is a common mistake that can generate artificially high numbers, distorting readings and even leading to misdiagnosis. When we speak, the body activates several muscles, including those in the chest and neck, which can temporarily increase blood pressure. Additionally, talking can cause involuntary movements that make it difficult for the monitor to function properly. These factors combined can add up to 10 points to the pressure reading. In medical offices, it is common for the healthcare professional to ask questions during the measurement as part of the consultation. Although this is understandable, it is important to ask for the conversation to be paused while the device is in operation, ensuring a more accurate reading. If you take measurements at home, create a quiet environment and stay focused on the procedure. Avoid answering questions, answering the phone, or performing any other activity that requires speaking during the measurement. These small precautions can make all the difference in the accuracy of the results. Additionally, it is always good practice to repeat the measurement if you notice that you have been talking or moving during the process. Having multiple readings can help eliminate the effects of any errors and provide a clearer picture of your health. Now that you know how something as simple as talking can change results, have you considered the impact of basing diagnoses on just one measurement? The next topic will reveal why this practice can be a dangerous trap. The dangerous trap of a diagnosis based on just one reading. Relying on a single blood pressure measurement to make medical decisions is a mistake that can have serious consequences. Although practical, this method ignores the natural variability of pressure throughout the day and the various factors that can momentarily influence it, such as stress, tiredness, or even the environment where the measurement is taken. Blood pressure is a dynamic indicator, which varies depending on the individual's physical and emotional state. Therefore, it is essential to carry out measurements at different times and conditions to identify consistent patterns. A single elevated reading may only be a temporary reflection of a stressful situation, not an indicator of high blood pressure. Unfortunately, in many doctors' offices, the practice of measuring blood pressure only once is common. If this reading is taken inappropriately, such as right after a walk or without adequate rest time, the numbers may be artificially high. In some cases, this can lead to hasty diagnoses and unnecessary initiation of pharmacological treatments. To get a realistic view of your blood pressure, it is best to take measurements at home, in a quiet environment, and at different times of the day. Recording these readings and sharing them with your doctor will allow for a more comprehensive and accurate analysis. Additionally, always question diagnoses based on a single reading. Ask the healthcare professional to repeat the measurement, preferably at different appointments, before making important treatment decisions. Now that you understand the risks of relying on just one reading, you are prepared to take a more careful and effective approach to monitoring your blood pressure. But how can you transform all this knowledge into a routine that really protects your health? Find out in the motivational ending to come. The key to a healthy life starts with accurate measurements. Now that you know the most common errors when measuring blood pressure and how to avoid them, you are one step closer to taking better care of your cardiovascular health. Every detail you adjust, every habit you correct, brings you closer to more accurate monitoring and more informed health decisions. Blood pressure is not just a number. It is a reflection of what is happening inside your body, an indicator that can prevent serious problems such as heart attacks and strokes, as long as it is interpreted correctly. By adopting appropriate practices, you take control of your health and reduce the chances of misdiagnosis or unnecessary treatments. Remember that consistency is the foundation of everything. Create a routine to measure your blood pressure at regular times, always on the same arm and with ideal resting conditions. Write down the readings and take this information to your doctor so he or she can monitor your health more effectively. Finally, never underestimate the power of small changes. An adjustment to the cuff, the correct position of your arm, or the simple habit of emptying your bladder before taking a measurement can transform the way you monitor your blood pressure. These simple steps make all the difference in ensuring the numbers are accurate and reliable. Your health is the most valuable asset you have. Take care of it carefully. Always seek reliable information and do not hesitate to consult a healthcare professional whenever necessary. With appropriate practices and a commitment to well-being, you can live more peacefully and healthily.